Topping news headlines today, a case of the measles has been confirmed in McLennan County. According to health officials, the patient is an unvaccinated child. 6 News reporter Sydney Walker is live in Waco with more about what local health officials are recommending to keep Central Texas safe. Sydney?
The interim director of the Public Health District here in Waco told me that they were kind of expecting for the outbreak of over 700 measles cases to find its way here. She said that they're staying vigilant.
Issues with the neurological system, and unfortunately can cause pneumonia and even death.
Dr. Samuel Clark from McLean Children's Hospital in Waco emphasized it's highly contagious.
For influenza, which is the flu, its R0 is a factor of 1.3 to 1.8. And so we know how contagious flu is. In perspective, measles is a 12 to 18. It's insanely contagious.
And now it's confirmed to be here in Central Texas, McLennan County to be exact.
They were not tested in McLennan County, but they are a resident of McLennan County, and they were confirmed yesterday.
Stephanie Alvey from the Public Health District said the case is an unvaccinated minor. The child is not currently hospitalized and is at home quarantining due to the contagious nature.
If you're exposed, it can take 7 to 21 days to actually show symptoms.
Alvey said the health district has begun contact tracing and provided those exposed with isolation guidelines.
They did not have any local public exposure, so there's no notifications that need to be made there. The contacts have been notified of this case and have been notified of their exposure.
Luckily, McLennan County's vaccination rate is around 96.5%, Alvey confirmed. Clark said this makes a difference.
That overall outbreak is going to be much more mitigated because of the vaccination status.
Early signs of symptoms can be pretty vague. Because of this, Clark says to look for a constellation of symptoms.
You start with fever, full body rash lasting greater than 3 days with cough, runny nose, and conjunctivitis. That would be a situation where you'd want to contact, not necessarily go in, but contact your PCP's office to say, hey, can we talk about the symptoms? What do we need to do?
The CDC recommended schedule for measles vaccine is at 1 year old and then a booster at 4. Clark said everyone should have a healthy level of caution, but in reality, if you have had both measles vaccinations, there's only a 3% chance you could potentially get infected.
The vaccination rates or the immunity tends to be lifelong.
Clark said if you are unsure if you have had your MMR vaccine, you can always check your immunization records or ask your doctor to give those to you. If you have not had the MMR vaccine, you can contact your doctor or even come here to the Waco-McLennan County Public Health District for their free immunization clinic. That is during the week from 8 a.m. to 4:30 p.m. No appointment required. Live in Waco, Sydney Walker, 6 News.
Yeah, good to hear there was no public exposure and they're tracing it all. All right, thanks so much, Sydney.
Right.